Hey everybody, welcome back to my channel. We're talking about what to do with Lyme treatment failure today. I'm Dr. Diane. I'm chronic illness and Lyme and mold expert. And one of the biggest mistakes I see people make is where we're starting today. And then solutions and strategies for how to fix it is where we're going today. So there's this really sad thing that happens many times in medicine where when people get a diagnosis, doctors and clinicians often stop looking. So it can feel amazing from a standpoint of like, thank God, finally we have a diagnosis, right? With Lyme, it's never a fun diagnosis to get. But when you've been searching, and many people have been searching for years to figure out what's wrong with them, sometimes just hearing that, oh, there's a reason, can actually give a lot of relief. And I imagine many of you listening know what I am talking about here. Now, while that is good and while having that root cause is important and learning what treatment to do is important, one of the problems starts when it does not work, when treatment does not work. And what I see so frequently are people that are going from doctor to doctor to doctor in search of the perfect Lyme treatment. And they're trying this new medication and that new medication, and they're flying to this clinic and that clinic and spending tens of thousands, sometimes even hundreds of thousands of dollars to find the perfect Lyme treatment. Now, being in the Lyme, mold, and chronic infection world for 15 years now, one of the things I have seen in my clinical practice is if people are seeing doctor after doctor after doctor looking for that special Lyme treatment and it's just not working, it is almost every time, not because the perfect treatment hasn't been found, but because there's another main root cause that looks very, very similar and creates a very similar picture as Lyme. So we can have situations where we can have multiple root causes causing the same symptom picture. And then if we only work on one of those root causes, in this example, Lyme, oftentimes that is not enough to actually truly figure out the root of the disease and to actually get symptom changes is what I should say here. So we can be treating the Lyme and actually have a very effective treatment for the Lyme, but people can report saying, well, I don't feel any better, doc. So then what tends to happen is then they go to the next doc and the next doc and the next doc, and and they're always searching for that perfect treatment. What they need to be searching for is a doctor that's going to run tests to say, okay, we know it's Lyme. Great. What else is it? Because usually when our body gets out of balance, we start collecting things. So many of you watching probably know about co-infections, right? About infections that occur when we are bitten, and they are transmitted at the same time. So when we're bitten by a tick or a mosquito, whatever insect we're talking about, it will not just give us one disease it's carrying, it'll give us all of the diseases it's carrying. So many times in the Lyme world, if you're working with a Lyme literate doctor, they are looking for co-infections. They are looking for Babesia and Bartonella and Ehrlichia and Anaplasma and Rocky Mountain Spotted Fever and on and on and on and on, and that's great. However, if you're treating those things and you're treating those things and you're treating those things and you're not seeing any change, it might not be the treatment that's a problem. It might be the lack of finding all the root causes. So my first solution for you here is to go take my online quiz. It's getwellquiz.com. So super easy, getwellquiz.com. And what it's going to do is it's going to spit you out based upon your answers 3 of the top likely root causes and lab tests that are helpful for those root causes. So I would recommend starting with the Get Well quiz at getwellquiz.com so you can get an idea of, oh, are there things that maybe your doctor has not tested for, and what are those tests and what to talk to your doctor about and more. I can tell you that mold does come up a lot of the time in my Lyme illness population, and the symptoms are very similar. But also I've seen situations where it's hidden C. diff toxins. C. diff, a lot of people know as a gastrointestinal infection that oftentimes leads them to the hospital with really severe unrelenting diarrhea. But I've seen situations where people do not have that level of diarrhea or don't even have diarrhea at all, sometimes even constipation. And they have C. diff and the toxins from C. diff that are actually really contributing to the problem. So again, we want to think about the whole picture here because there's these standards, right? There's these like textbook normals that make us in medicine think, oh, that's probably C. diff, or that's probably this, or that's probably that. But then you're unique. You're an individual, and you don't always read like a textbook. In fact, most people do not. So we really want to consider like what other things could be fundamentally preventing somebody from getting well. So I've seen C. diff, I've seen mold toxins, I've seen Marcons. Marcons being a staph infection in the nose. It's very debatable. When you read online, you see like, oh, some people treat Marcons, don't notice a difference. Other people I've seen treat Marcons and have their world change. So it can vary as far as the impact of the results and the impact on the symptoms from person to person. It can widely vary. Also, and if you refer back to my most recent video I put out before this, and I do encourage you to subscribe to the channel so you get videos like this. In my most recent video on methylene blue, one of the things I was talking about there was mitochondrial health. And what we can see, and mitochondrial is a big buzzword, mitochondria is a big buzzword in medicine and in health right now. And mitochondria are the powerhouse of the cell, right? They're the parts of the cell that are turning energy, that are creating energy for the cell to do whatever the cell's job is, whether it's a nerve cell or a muscle cell or a gastrointestinal cell. So all of the cells need the mitochondria to get energy to do their job. And what can happen is we can have that mitochondria damage by things like Lyme and mold. Now, if we don't take away the damage is going to continue to be there. But when we heal the root, and we're getting to, say, Lyme, right? So let's say we do Lyme, we're like, okay, well, treatment's not working. Well, sometimes it might be the leftover impact on the mitochondria or other areas of the body where the cells are just not functioning right because they're damaged and they haven't had any work to repair them. So all of that is extremely, extremely important. Okay, everybody, that is it for now. It has been a pleasure to serve you. I will see you in another video. Please do take my quiz, getwellquiz.com.